And the seventh thing I want you to learn is this: the answer options are designed to test elimination skills. So most questions will have about 5 options, as the free questions have clearly defined, right? You realize that out of the 5 questions, 1 is clearly wrong. Number 2, 1 is an outdated, concept or an outdated management plan. The third is that 1 plan or 1 answer is too extreme. And then you will be left with these 2 answers where 1 is partially correct and 1 is the best fit. And look, if you doubt what I'm saying, go click on the free MCQ1 questions and you will understand exactly what this all means. The exam expects you to eliminate, not to guess. So how to approach the options? What you need to do is to cross out the clearly wrong ones first. Then you compare the last 2, which I said, 1 is partially correct and the last 1 is the best fit. The correct one will usually be the one that is the safest for the patient, the most logical, and the most practical. So how should you attempt the free questions? With all that I've said, when you go to the free questions, number 1, please read slowly. Number 2, take time to think through the questions before you click. And number 3, focus on reasoning, not speed. Because after each question, you review why the wrong options were wrong. Don't use them to test your intelligence. Rather, use them to understand the exam's thinking style. That's the real value of those free questions which have been given to you. Because if you approach the MCQ1 with the right mindset, the exam becomes very clear, you become very calm and more predictable, and this is exactly how we train our candidates as MedCognito. Not just how to know medicine, but how to think the way the MCQ1 expects you to think. So now go and attempt the free questions, but this time do it with intention. And when you are done, you realize the exam isn't an unfair exam. It's rather just a very specific exam about how you need to think in a Canadian context.